Sexual minorities all over the world have been subjected to a phenomenon with many names and different faces. It has been called reparative therapy and sexual orientation change efforts, but is more widely known as conversion therapy. What exactly is conversion therapy? In what ways does it come? What is the efficacy and ethics of these practices? Finally, what effect does conversion attempts have on an individual throughout their life? Having been a subject of conversion therapy as a child, I have always sought to answer these questions. Now, through research involving peer-reviewed scientific articles and studies, opinion pieces, anecdotes, and my own experiences, I have gathered an eclectic body of work with the aim to answer these questions. Why explore this controversial and oftentimes difficult area, or what many today perceive as a distortion of psychology? A 2018 study published by the UCLA School of Law and referenced in the 2020 United Nations General Assembly Human Rights Council publication on conversion therapy concluded that 698,000 lesbian, gay, bisexual, trans, or gender diverse adults in the United States between 18 and 59 years of age, and almost 20% of trans adults who had ever spoken to a professional about their gender identity had been subjected to such a practice in their life. As will be evident in my findings, conversion therapy has numerous consequences that sometimes span a lifetime on an individual. Since it continues to be used, LGBTQIA2+ people, allies, policymakers, and the general population have the responsibility to understand this practice, its uses and effects, so that future considerations, conversations, and decisions on conversion therapy can be understood in its full perspective. Conine and Associates define conversion therapy as any practices intended to alter a person's sexual orientation, gender expression, gender identity, or any combination thereof. Although the term therapy, which means a treatment intended to heal, is, as you will see, misleading. Conversion therapy practices have been documented starting in the 20th century and continue today all over the world. To answer the questions I proposed earlier, I have studied 10 peer-reviewed publications that include articles, research, opinion pieces, and stories of those who have participated in any form of conversion therapy. My findings have been explicit, illuminating, and deeply disturbing. To understand the full context of conversion therapy, its origins must be considered. In 1952, the American Psychiatric Association listed homosexuality as a mental disorder in the Diagnostic and Statistical Manual of Mental Disorders, known in short as the DSM, which is a publication the APA uses for the classification of mental disorders and that psychiatrists use to diagnose and treat their patients. In the article, Out of DSM, Depathologizing Homosexuality, Drescher outlines various theories of homosexuality, one of which fueled the decision of the APA to classify homosexuality as a mental illness in the DSM. Theories of pathology regard adult homosexuality as a disease, a condition deviating from normal heterosexual development. Drescher writes, these theories hold that some internal defect or external pathogenic or diseased agent causes homosexuality. This theory is the catalyst for practitioners of conversion therapy. Practitioners of conversion therapy used and continue to use this theory alongside early versions of the DSM to justify their treatments. Even though in 1973, after numerous debates, votes, and activism by LGBTQIA2+ people and organizations, the APA made the decision to remove homosexuality as a mental illness from the DSM. Every publication since has not included same-sex attraction as an illness. So why do conversion therapy practices continue? Conversion therapy comes in many different forms and from many different places. In Changing Sexual Orientation, a Consumer's Report, Shidlow and Schroeder define sexual orientation conversion as any therapy administered by a licensed psychologist, psychiatrist, social worker, family and marriage therapist or counselor, as well as individual, couple, and group interventions administered by peer counselors and religious counselors, which the consumer viewed as explicitly aimed at changing a homosexual orientation. Jones and Associates report that conversion practices include counseling, group work, programs of intervention, perhaps therapeutic corrective prayer, performing celibacy or endorsed sexual relationships, personal or group behavioral suppression, etc. Haldeman expands, conversion therapy has historically included behavioral, including aversive therapy, cognitive, and psychodynamic interventions. But what does this all mean? In an anecdote, Haldeman tells Jim's story. Jim came to traditional therapy having undergone one of the most brutal and psychologically invasive forms of conversion therapy, electric shock treatments. During treatment sessions, Jim would view gay pornographic pictures while an electric shock was simultaneously delivered to his hands and genitals. The cessation of the shock would be accompanied by heteroerotic material. Although not all conversion therapy practices involve physical harm, Taglienti reinforces how severe conversion techniques can be, including inducing nausea using drugs, using shame to create aversion to same-sex attractions, orgasmic reconditioning, teaching heterosexual dating skills, and trying to make a patient's behavior more stereotypically feminine or masculine. An important question is then raised. What is the efficacy and ethics of conversion therapy practices? The answer is consistent within all findings. It is neither effective nor ethical. Peterson et al., Shidlow and Schrodner, Jones et al., Haldeman, Jenkins and Johnston, Koenig et al., Taglienti, and the United Nations Human Rights Council, or every source and study I found from the past 20 years, have discovered conversion therapy to be harmful. Among all these articles, numerous negative effects including, but not limited to, depression, suicidality, decreased self-esteem, and self-hatred have resulted in individuals in the short and the long term who participated in any form of conversion therapy. That is consistent within every credible study. If one honors the Hippocratic oath of first, do no harm, there is no chance that these practices can possibly be ethical. Disturbingly, Jones and Associates found that individuals who had attended a conversion practice were over 2.5 times more likely to think about or plan suicide, and almost 4 times more likely to attempt suicide than individuals who had not attended a conversion practice. Furthermore, they found that there was an association between having attended conversion practices and being more likely to have had a diagnosis for mental health conditions considered, such as depression, GAD, PTSD, bipolar disorder, panic disorder, social phobia, agoraphobia, OCD, schizophrenia, and eating disorders. Participants of conversion therapy are at least 1.5 times as likely to have a mental diagnosis, including almost 3.5 times as likely to have been diagnosed with post-traumatic stress disorder, and almost 5 times as likely to have been diagnosed with schizophrenia.
Trapped inside the prison of you, every darkness all around me, burning in hell with the devil. Beelzebub, please get me out here. Trapped inside.
As you have now seen, conversion therapy is a serious practice. It has deeply harmful effects on those who are subjected to it and ethically can't be allowed to continue to take place in today's society, no matter what part of the world. We have learned that conversion therapy is any attempt to change a person's sexual orientation, identity, or other. Historically and in present day, it has been practiced by licensed mental health professionals, but oftentimes is practiced by unlicensed practitioners and clergy. Conversion therapy is highly ineffective, and the methods used to perform them are highly unethical and deeply disturbing. Most importantly, it does enormous psychological damage to a human being throughout their lives, even in those who may have considered their conversion a success. Limitations to my research include few studies and mentions of beneficial aspects of conversion therapy, which are rare and all of which can be achieved using other methods that do no harm, such as affirming therapy, and future works should aim to further document the harmful effects and practices of conversion therapy so that actions can be taken by societies to entirely eradicate them.
Don't wanna fall for you again.